Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Delito, a family physician. I have an interest in public health and cancer treatment and prevention. In this video, we are going to look at myocardial infarction. We are going to look at what is myocardial infarction, who gets it, how does myocardial infarction present, what are the risk factors for getting a myocardial infarction, how can we prevent one from getting myocardial infarction, and how do we prevent ourselves from getting this condition. Welcome. So myocardial infarction is a situation whereby there is complete blockage to the blood supply to the muscles of the heart, and this happens as a result of progressive blockage of the coronary arteries supplying the heart. And if there is complete blockage, then this leads to muscle death, and this can be due to rupture of an atherosclerotic plaque or formation of thrombus, or if there is anything that happens to when you have an atherosclerotic process, if the upper part of the plaque is worn off, and then there is multiplication and the process of cell clotting happens, then there is complete blockage of the mass of the blood supply, and this leads to sudden muscle death to the affected part of the heart muscle. So the risk factors for this can be classified into those that are modifiable and those that are non-modifiable. The non-modifiable ones include age. As you age beyond the age of 65, your risk of getting a myocardial infarction increases. Males are more affected than females. Those who come from a family where there is a risk of a heart attack are at more risk. And those who have had premature cardiac events, some families are more affected than others. Then the risk factors for the modifiable ones include things like smoking. If you're a smoker, then you're at more risk. Having hypertension, having abnormal cholesterol, having diabetes mellitus, being obese, living a sedentary lifestyle, excessive alcohol use, and also inadequate treatment for high cholesterol. So how does a myocardial infarction present? The typical symptom is chest pain, which is usually retrosternal, which is the central part of the chest. The pain is crushing and it is debilitating. The ability to undertake any activity because of the pain is markedly reduced, and the pain can radiate to the left arm, it can radiate to the jaw, it can also radiate to the back or even to the right side of the shoulder. Then it can be accompanied by difficult breathing, especially due to the pain, and you feel like you are breathless, you are struggling for air. You can have nausea and vomiting and general body weakness, and can lead to fainting. You may have sweating and general loss of body energy. We may have a typical presentation, especially in the elderly people and the people who have diabetes, who might present with the epigastric pain or just generalized body discomfort or generalized body tiredness, and they might sometimes have fainting episodes. So for those people who are the elderly, the people who have diabetes, unusual presentation, then you need to think, could this be a heart attack? So how do you make a diagnosis of a myocardial infarction? One is the clinical history. What are the risk factors that an individual has? Those who have diabetes, those who have hypertension, those who have been smoking, those who have high intake of alcohol, someone with abnormal cholesterol. Then these are some of the risk factors that could make you think that this individual could have a heart attack. Then of course there are the blood tests, which include the biochemical markers, what we call troponins, and you may have a CK and B, which are cardiac markers for myocardial infarction. Then the gold standard, what you should start with for anybody who presents with health care with chest pain, has diabetes, or any of the other risk factors that we have talked, is doing an ECG, which is, as I said before, a rhythm check of the heart beating, and it also gives you an idea of this, what we call the ST region of the ECG, and if it can be elevated or it can be depressed depending on what is the extent of the muscle blockage. Of course, you can do an echocardiogram, which is an ultrasound of the heart, and this will help you see the abnormalities of the motion of the muscle of the heart, and you can tell that this part of the heart is not mobile because it has no blood supply, and you can comfortably make a diagnosis of a myocardial infarction. Of course, there is coronary angiography, whereby a dye is put and it shows you the flow of the dye along the coronary arteries, and you can see where there is blockage and the part of the heart that are not getting adequate blood supply. So the treatment of a myocardial infarction is an emergency. This is a life-threatening condition, and in the emergency room, then you check the airway. You make sure that the individual is breathing and the circulation is adequate. Then of course there is the relief of the pain using morphine. Oxygen therapy helps to improve the blood supply to the heart. There is the use of nitrites, and also there is the use of aspirin to try to help reduce the process of clot formation, especially the aggregation of the platelets. Of course, there is reperfusion therapy where you can use thrombolysis, and then there is also percutaneous coronary interventions using coronary catheters to try to open up the blood vessels, and then the perfusion of the heart muscle. There is the medical management using of the antiplatelets like drugs like aspirin, clopidogrel, and the other anticoagulants like heparin. Use of beta blockers to try to reduce the heart rate, and also ACE inhibitors or ARBs to vasodilate, and the use of statins to control the cholesterol. Then there is rehabilitation after myocardial infarction, which will include lifestyle changes, looking at your diet. You need to modify your diet, getting to more of the healthy diets, which include diets with high fiber, use of more fruits and vegetables, and of course exercise, whereby you progressively engage in an exercise program, but you start slowly and then you build up progressively as your cardiac condition improves. And then there is also control of the risk factors, which include diabetes, hypertension, abnormal cholesterol, and also obesity. This needs to be controlled to avoid the recurrence of the myocardial infarction. Of course, the worst that can happen if you get a myocardial infarction is death. And this is, as I said, is a life-threatening condition, and so we should be able to know and recognize the symptoms and reach out to the healthcare system as soon as possible. Every second counts for a heart attack. Then complications include arrhythmias, which are abnormal rhythms of the heart, like atrial fibrillation, which we are going to talk about possibly in one of our upcoming talks. You can have heart failure. You can also have pericarditis, and you can also get blood supply compromise and get into what we call cardiogenic shock. Late complications include ventricular aneurysm, of course recurrence of the myocardial infarction. You can have chronic heart failure, and of course the worst is the sudden death. So how do we prevent yourself from getting a heart attack? For personalized care, Please, you can call the number on the screen for more advice, and you can also, I also encourage you to subscribe, like and share, and also share your comments on the comment part of this video, so that we can know what are some of the challenges that you have and what are some of the concerns that you have. So on the prevention of myocardial infarction, there is the primary prevention, which include lifestyle modification, including smoking cessation, healthy diet, regular exercises, management of diseases like hypertension, diabetes, and the hyperlipidemia or abnormal cholesterol. Then there is secondary prevention, which is adherence to medications, the antiplatelets, the statins, having regular follow-ups, and also stress management. So myocardial infarction is a critical medical condition. Recognizing the symptoms or the risk is paramount, so that you seek medical care as soon as possible. So share this information within your circle, so that all of us can be able to recognize the risk factors of getting heart attack, and they also take the necessary precautions. There is importance in early diagnosis of the risk factors and the treatment, and of course there is a big need to adopt our lifestyle, so that we are more active with the exercises and adopt a healthy diet. Thank you for watching.